And can you tell me more about that center as a whole?
Yeah. So we've been around since the early 1950s. We started off as a community mental health group when a woman by the name of Dee Dee Hirsch identified the need for mental health therapy and resources for people who don't have access to care. So that started back then, and then since then has developed into over 10 sites in Southern California, one being the Suicide Prevention Center. So I have been with the Suicide Prevention Center since 2007, so 14 years. And we have a 24-hour crisis line that's available both in English and Spanish for people who call the National Suicide Prevention Lifeline, that 1-800-273-8255 phone number. Additional to that, like I mentioned, we're in English and Spanish. We are also one of 3 centers that fields calls for any human-made or natural disasters, which most recently and most prevalent is the COVID-19 crisis. So we're available 24/7 for people who might need emotional support as a result of those human-made or natural disasters. Also, we're available, we have crisis chat. So through the National Suicide Prevention Lifeline, we provide resources for people through an online platform via chat to reach out. For a lot of people, picking up the phone could be a really big challenge. So the platform of chat really allows people to reach out maybe they wouldn't have otherwise. And then we have a couple different local crisis lines that we help out with. We have a local teen line that we answer their after hours for. They are a local line, but they're available nationwide. And then additional to that, we're available 24/7 for the deaf and hard of hearing via text. And gosh, that's just a part of what we do. We also do a lot of outreach and training out in the community. And then in our location, we also provide mental health services for people who have lost someone to suicide, whether it be one-on-one therapy. Additional to that, we also do group therapy for people who have either are grieving the loss of someone to suicide or have lived through a suicide attempt, which is what we call someone with lived experience. And that's a lot of what we do.
And have you seen your numbers rise, fall, stay the same throughout COVID-19 before and now?
I mean, I think ever since the loss of Robin Williams, back in, I think that was 2014 or 2016, we had a new normal at that point. And then as different various things occurred, especially in this last year with the civil unrest, the racial injustice, the systemic racism, all of those things on top of the COVID-19 crisis. And, a lot of people are also impacted by the political climate, that our call volume has increased. So our disaster distress helpline, COVID-19 related calls from January to September, we answered 12,000 related to COVID-19, and that's 13% of all of our suicide prevention calls. And April and May really had the highest COVID-19 related calls. But we did have an increase of COVID related calls. January last year, there was 2. February of last year, 2020, there was 21. And then it skyrocketed to March at 1,800. April 2,800, May 2,200. So, and then since then has remained in the thousands.
Wow, that's shocking. So I'll ask a 2-parted question at this point. So why is it so important for us to have hotlines in general? And then why is it important to have it now, since COVID is a very big part of our lives?
Those are both such important and great questions. So I think, hotlines in general really act as a bridge between, immediate support, because of course we're not all trained therapists. We do have some people who are by trade clinicians, but when everyone's on the crisis line, they're considered paraprofessionals. And oftentimes in the midst of feeling lonely or an acute crisis or any type of situation at hand, there can be that emotional impact. And oftentimes people don't necessarily feel comfortable talking to a loved one. They might not feel safe sharing it with someone that they know, because they might have been dismissed by them in the past, or even People don't know exactly what to do or how to support someone who's in crisis. So oftentimes we hear that people reach out to us as a crisis line because they want that anonymity. And it really provides them an outlet and support by someone who's trained, but also they feel a level of anonymity because they don't know the person on the other end, and vice versa. And that makes a lot of people feel a lot more comfortable to really share and be honest. So that's one part, especially now, given that we're in this global pandemic, which is something I think a lot of us are still trying to process. There's a lot of isolation, there's a lot of loneliness, there's a lot of depressive symptoms. I mean, there's so many stressors that are going on since the COVID-19 pandemic started that a lot of people are seeking connection. And I think oftentimes people don't know who to reach out to, especially in a moment like this, because maybe they themselves are struggling, but so are their peers or their family and friends. So they might want to speak to someone who, is trained, but also can be there as a specific resource. So I think especially right now, people are really seeking out connection and support, and a crisis line is a great way to get that.